A video showing a nurse allegedly refusing to assist a patient has been circulating online. In the video, the nurse is seen pacing around as a woman questions her refusal to give her medical attention. Now, the video has circulated throughout social media, raising the question around medical xenophobia and what the law says about treatment of all patients who present themselves to a healthcare facility. Now, take a look at this video.
Hey, Agafuni, you're the one who doesn't want. They say she must read me transfer. She's not. No, I came here what time? I can't wait anymore. I can't. Read me a transfer. Let me go to the doctor. Please. Shout as much as you want. Let everyone hear you. I want her to take a peek here. I want her to sue me, post me. I'll sue out of you. I can't wait anymore. I can't. Read me a transfer. Let me go to the doctor. Please. Shout as much as you want. Let everyone hear you. I want her to take a peek here. I want her to sue me.
All right, let's get a response to this now with Health and Allied Workers Indaba Trade Union Secretary General Lerato Mthunzi, who joins me on the line now. Good morning, Lerato. Thank you very much for joining us. First and foremost, what was your immediate and initial reaction to this video?
Good morning, Ms. Chaba, and to all the viewers at home. I think initially when we saw the video, we thought, look, there's more to this than the small clip that we got. And we got a team on the ground to just, find out from obviously eyewitness and try and track this nurse ourselves. This is a clinic in Midrand in Halfway House, and I personally spoke to her just to understand what had actually transpired, what would lead to a person that's supposed to be in the line of duty, a professional that understands how to treat patients, would lose their cool like that to a point of, not actually caring about what happens next. And I think on our preliminary investigation, we have been informed that this is a patient that has been in the, uses the facility, and we have concluded that, to be honest, there is no issue of, Afrophobia, xenophobia, or just not wanting to treat our fellow South Africans. And I mean, I think the whole issue of the Constitution, Section 27, and all healthcare workers understanding that, everybody that is in this country is entitled to healthcare. It's not what the issue is here. The issue is that this patient has visited the clinic a couple of times and had, in the 3 occasions where this nurse has treated her, has actually targeted this nurse. And that video clip where we are seeing the whole altercation had been ensued for more than 1 hour, 30 minutes. The assistant charge was aware of this, the colleagues were aware of this, and nobody had actually come to the rescue of saying, look, I'll take over this patient. You guys are having an unnecessary, to and fro. Other patients were also involved. And we've since also learned that this patient, and the patient that was also treated by the nurse that had to be removed from the room by this very patient, has also laid charges of even assault. The nurse was assaulted by this patient as well. We've learned there's a case, and we've spoken to also the police handling the case in this regard. So what we're seeing is just a reaction of the patient thinking, obviously, we are going to paint this particular nurse, and I'm going to make sure that she loses her job. And I think that's an unfortunate situation, to be honest.
All right. So we do have to present a balanced perspective. And just to be fair, the Young Nurses Indaba Trade Union stands firm with the nurse in the viral video, as you've just indicated. But also, you've issued communication that says, defend South African nurses. Foreign nationals are exploiting our healthcare system and bullying our nurses online. This is our country, and our resources must serve South Africans first, which, as we know, technically goes against the Constitution. So how do we know that there isn't any bias coming from the YNITU?
Look, I think we've been very vocal in all the incidences, and even when the MEC of Health in Limpopo attacked a foreign national in the hospital. That case has since been to the HPCC. We've said, look, we are expecting healthcare workers, we are expecting those in the positions of authority to be able to, dispense healthcare to all persons in the country. However, at the same breath, we are saying there is no way that our government that we've all voted continues to fail to monitor our borders, continues to provide healthcare for the 60 million South Africans and plus all the foreign nationals that we have in our country that we are not able to clearly cater for. We've complained about shortages of staff. And if we are catering for those numbers, the number of nurses, doctors in our healthcare facilities needs to be more. That's number one. Number two, the resources needs to cater for South African, but also those who live in our land. We don't stand for anything that talks about discrimination. But what we are being firm about is that the goalpost now has shifted completely to the community we serve. South Africa is also included to fight healthcare workers rather than go where the problem is, which is our government that is failing to provide necessary resources, the Department of Home Affairs that is not able to deal with the issue of our porous borders. And that is the bottom line. The fight here, it's not against anybody that is here for whatever status they've got. It is the government, two departments particularly, the Department of Health as well as the Home Affairs Department. We definitely think that our healthcare workers are being overstretched and no one is actually talking to this topic.
All right. Tell me about the planned march that is, you're in preps for that. When is it happening and what are your plans for that proceeding?
Tomorrow in the morning, together with Progressive Forces, and this is an organization that is very vocal on ensuring that particularly the Department of Foreign Affairs, Home Affairs are held accountable in terms of, the influx of every person that is in the country, whether black, whether white. And I think we are just saying, look, we have to make sure, let's go to the hospital, let's engage management. Those who needs to respond, even the MEC of Health, needs to come to the party and tell us, why do we have 2 nurses that are seeing patients in this facility? Why are we getting community that is frustrated and taking their frustration out on healthcare workers? Why do we have 1 doctor that comes only on Tuesday in this clinic when this issue, this whole altercation can definitely be averted? So our standing in the gap is particularly to address the issues of resources, that is human resource, material resources, but at the same time address the issue of the community themselves, the community that the nurses are treating, and find a common ground.
All right. I think that is very clear. Lerato, thank you so much for your time.
Thank you.